Good afternoon, and thanks for joining us for Including All Kids, Improving the Healthcare System for Kids with Developmental Disabilities. I'm Kelly Caseman, the Executive Director of Think Kids, and we're going to spend the next hour talking with 5 panelists, 2 parents, 2 medical providers, and a lawyer, whom you're going to meet in a minute, about the challenges, experiences, recommendations, advice, and next steps in improving the way we navigate kids through the West Virginia's healthcare system. You're welcome to write any questions or comments you have in the comments portion below the video, and we'll get to them as the conversation progresses. Maddie, our social media volunteer, will be joining us today to keep an eye on what you're writing, and we'll share them throughout the hour. I'll introduce the panel in a minute, but first I'd like to spend a bit of time talking about this project. Including All Kids is funded by the West Virginia Developmental Disabilities Council, and we launched it in January. For years, it's been increasingly clear that there are significant challenges to ensuring healthcare access for children and families with special needs in our rural, medically underserved states. Families often struggle throughout the process of accessing care, from getting a correct diagnosis to finding specialty care to accessing community resources for even the most basic of health services. There's so much to discuss with so many variables that it's hard to wrap your head around it unless you're in the thick of it, like parents or providers or advocates. So today's conversation is an effort to raise awareness of these challenges and hear from folks who are approaching this system from different perspectives. I'd like to introduce our guest and ask them to share some information about themselves and how they came to work with and advocate for children with developmental disabilities. And I'm going to go in alphabetical order. So we're going to start with Allison Bungard. I'm sorry, Allison, you're on mute.
Hi, my name is Allison Bungard. I am the mother to a 13-year-old teen with cerebral palsy. He has a number of other diagnoses as well. He attends middle school. So I started advocating for him right after he was born, and we understood that he was going to have developmental disabilities. And in addition to that, professionally, I am a lawyer. I actually represent companies in labor and employment disputes, but much of employment law relates to issues like the Americans with Disabilities Act. And so I have some experience professionally working with companies in that area as well.
Oh, wonderful, Allison. Thank you. Dr. Linda Freeling.
Hi, can everybody hear me? I'm okay. So I started out as a neonatologist and took care of the tiniest babies many, many years ago. And then I became very interested in following them throughout their lifetime. So I've been following NICU babies for 30 plus years. And it expanded to other kids with all kinds of medical fragility and complexity. I was brought to West Virginia by WVU. They really didn't know what complex care and home care, what it involved. So I've developed a clinic at WVU to coordinate the care in a patient-centered, family-centered model. This is my passion, and I'm so happy to be part of this panel. We are really working hard to gain access and help families maneuver the healthcare system when they have these very special, heroic little children.
Thank you so much, Dr. Freeling. Dee Laymaster.
Yes, my name is Dee Laymaster, and my passion of life started back in 1990 when I got injured and was home all the time. So I tried to find something new to do that would be helpful and kind to others. So I started doing foster care, got the first child in 93. A year or two later, I got the 2 siblings. 98, I had adopted 3 children singly. They had ADHD, bipolar, developmental delays. My 4th child is fetal alcohol, but a total of 36 children we've adopted, and they're all special needs. 3 of them recently in the last 9 years were diagnosed with autism. And because of the autism diagnosis and all the other things, we've constantly navigated through health psychological assessments, evaluations, educational IEPs. We also work with families that have addictions, and we volunteer to take in their children while they go get help and relief. Been a foster adoptive parent for 36 years. And a passion gets deeper from some of the experiences we can talk about a little bit later.
Great. Thank you, Dee. Next up is Dr. Jody Lindsey.
I'm a practicing pediatric neurologist and neurodevelopmental disabilities specialist at WVU Children's. I have been back in the state practicing for about 12, 13 years now after returning from my specialized training. I have had a desire to improve services for children and families with developmental disabilities in the state since starting back in high school. I'm born and raised in West Virginia. And slowly, much more slowly than I would like, but surely we've started developing a neurodevelopmental program. I'm the director of the WVU Medicine Children's Neurodevelopmental Center, and just recently also stepped up and am chief of pediatric neurology here at the hospital.
Wonderful. Thank you, Dr. Lindsey. And then Shauna White.
Hello, I'm Shauna White. I'm an attorney from Disability Rights of West Virginia. I've been with Disability Rights for going on 5 years now, but it has always been my passion to work for the rights of people with disabilities and to improve accessibility to the community as well as, try to get rid of some of the stigma associated around certain disabilities. I work a lot on accessibility issues with healthcare, and I work a lot with getting people connected to the appropriate community resources to help them.
Great. I am so excited about this panel. Thank you all so much for joining us. So let's jump into question number 1. Here's a hypothetical scenario. You're a mom or dad who suspects that your child may have a developmental disability. She's not meeting developmental milestones. What next steps do you take, and how would you prepare for the discussion with your doctor?
I'm willing to answer or give my perspective on that. A lot of us come into this system different ways. My son happened to come in because he was he had intrauterine growth restriction, was in the NICU, and so we came in by NICU, and we did self-referral, and our pediatrician gave us referral to Birth to 3. So we did have access to some Birth to 3 providers, as we were trying to work on getting a diagnosis. But I think some of what I'm about to say would also apply whether you're working with somebody or not. If you happen to have Birth to 3 providers, I would recommend asking them if there are any questions or any concerns that you should add to your list of things to talk with to the doctors. And I'll give you an example. In my son's case, he was holding his palms like this. This is a clear symptom of cerebral palsy. As a mom, I would not have known that. But my providers did. So I added that to, the list of things I needed to mention to the neurologist the next time that we saw the neurologist. Take a picture or a video of your concerns. For example, we started taking videos using our phone of my son when he started having seizures. Because we believe they were seizures, but he wasn't having seizures in front of his doctors. So we had to take a video of that. Now, I admit it's scary to do that while it's happening because you're trying to, help your child and yet tape this at the same time. But we were able to give those videos to our neurologist, who looked at them and immediately said, yes, these are seizures. So pictures, videos. Keep a notebook, whether that is physical or electronic. And I say that because when we started down this path, I actually had a physical notebook that I would write notes in But now, a lot of phones can handle those things, but you need to have a system set up where you can keep your questions and your concerns together. And then before your appointment, you basically need to synthesize those concerns, because you may only have 15 to 20 minutes with your doctor. So you don't want to forget things. You need to bring a notebook with you, because you will forget things that they tell you. If it's a big appointment, it's a great idea to bring your spouse or a relative or even a friend with you, who can help you um, listen to what it is that you're saying, that they're saying, so that when you walk out and you're revisiting these conversations, just two heads can be better than one, as to understanding that. And then I would say, even if you have an electronic notebook, I would recommend that you bring a folder or a file of some sort, because often they will give you handouts, or like, for example, when we're with the physiatrist now, they'll give us a handout of how much Botox they injected in our son, which muscles, and I could give that to the PT. But you're going to need to have some place to hold this all together, so that you don't lose it, because usually when you're at big appointments like this, there's just a lot going on. And then I would also say, and this is definitely a do as I do, more than do as I say, but keep a notebook, keep a filing system. Think about how you're going to keep your records. So for example, we keep our EOBs by data service, things like that, so that you can easily find that information when you need it. And so actually, we go to Children's Hospital Philadelphia, and some of my stuff isn't well attached right now, but they gave us this care binder, and you can actually print downloads from their website, that has information like things to do, questions to ask the doctor. Now, at this time, I do keep a lot more of it electronically, but this notebook goes with us to all of our appointments.
Can I add? So Allison's suggestions are amazing, right on target. From a standpoint of general pediatrics, many times those visits are so short, the well child care visits, that parents feel rushed and feel like they can't ask certain kinds of questions, especially if it's vague in their minds. My advice to all parents is be persistent. You know your child better than anybody. The child will not necessarily show the doctor in a snapshot moment of 15, 20-minute visit what the parent is concerned about. The video idea is so important. And then be persistent, because pediatricians want to help you. And even though they may be strapped for time, if you're persistent, they will open up. And so I think that this is all amazing advice for everybody, no matter what the child's problem is.
If I could pipe in here a minute, one other additional thing that I do as a parent when I go, and if it's a long meeting or confrontation with the doctor to try to figure out what's best for the child, and I want to share with my husband later, I even ask the doctor if they mind if I record, not so much video, but voice, what we're talking about and discussing, so that I don't forget something small that may be very important to the care of any of my children.
That's great advice. Anything else before moving on to the second question?
One last thing I would throw in is, just like Dr. Freeling said, I completely agree, kind of staying with your pediatrician. The parents do know, or the caregiver knows the child the best, and their time is limited. And so sometimes it can be hard to get that secondary referral to another specialist. But one of the important things to know, for families to know if there is a concern early on, that a lot of the resources and recommended interventions that are kind of similar across the board, no matter what the ultimate diagnosis is available prior to that subspecialist visit and that official diagnosis. And unfortunately, a lot of families are counseled inappropriately that, oh, we can't do this service, we can't start this therapy until you have an official diagnosis. That's not true. So birth to 3, as most individuals know, and a lot of families don't know, is that it can be just parent referral. You don't need a referral to the program from any provider. It can be self-referral from the parent to get initially started and evaluated. And then in addition to that, your general pediatrician or medical provider, whether that be family medicine or pediatrics, they are able to prescribe some of those early interventions and therapies that even without a specific diagnosis, whether you're a child with global developmental delay or you're a child with autism spectrum disorder, that occupational therapy and speech therapy is still going to be helpful for you. Now, it doesn't mean don't pursue that complete specialist evaluation, but you don't need to delay treatment for a lot of things.
That's really helpful. Thank you. Maddie, do we have any questions regarding this online?
No questions so far. We just have people who are grateful you guys are sharing information.
Thanks, Maddie. Okay, let's move on to question number 2 then. If your primary care provider refers you to a specialist for a more in-depth evaluation of your child, what should you expect and how should you prepare?
Well, I think some of what I said last time would apply to this as well. You know, your notebook, keeping questions, videos, things like that. I think you have to also know there's sort of a difference between some appointments you go into, you already have a diagnosis, and then there are other appointments where you're looking for a diagnosis, or maybe not even a diagnosis, but you know there's an issue. I mean, there are some kids who have conditions for which there is no diagnosis, but you've still got to have, you know, treatment of some sort. So what I often do are, one, know whether your situation is an emergency or not, because a lot of times a doctor's office will call and they'll give you an appointment date or time and it doesn't work with your schedule. So then you need to call the office and, you know, and get that moved. And so you need to know whether it's an emergency, because if they need to see you sooner rather than later, then, you know, you may not be able to move your appointment very far. And it's often very difficult to get in to see some specialists. I would say that I usually check our doctors' resumes that are online, especially the ones that are associated with children's hospitals, because a lot of times I get a sense of the expertise that they have in my child's conditions. You need to make sure, whether it's collecting yourself or getting your doctors to send any relevant x-rays, test results, any of that, you know, visit summaries to the doctor, so that you have those with you when you get there. At a lot of the big children's hospitals, like when we showed up at CHOP for the first time, they had clearly read everything we provided to them before we got there. They knew exactly what the problem was when we got there. You need to find out how long a general appointment takes. For example, the first time we showed up at the Cerebral Palsy program at Children's Hospital of Philadelphia, it is a day-long program. So you need to like, you know, for us, we needed to make travel arrangements, hotel reservations. We needed to figure out what we were going to do about our meals, like breakfast, lunch, those types of things. The way their program is set up, they put you in a room and all of the providers actually come to you. So you don't really leave that room during the day unless it's to go get like an x-ray or a test or something like that. But you need to know that information. You also need to check with your insurance and or Medicaid to see if this visit is going to be covered. And many programs, like I know that the CP program at CHOP, they have social workers who are assigned specifically to that program, who can help you find things like reduced rates for hotel rooms, tell you what hotels are in the area. Look at things like the Ronald McDonald House, or in Philadelphia, they actually have a program called Hosts for Hospitals, where you can stay. You have to get approval. You have to get your doctor to sign off on this, that you're basically like a safe person. But that we've actually stayed with people in their houses, in a room in their house, and in order to go to our appointments. So you have to be thinking about the medical sides of things, and then there's what I'll call, I guess, these logistic sides of issues, so that your appointment runs smoothly.
I would add, this is important information, especially when you know that your child has a certain diagnosis. If you don't know, I think there's a certain amount of mental preparation before seeing a specialist that needs to happen, and emotional support. And I would suggest don't go alone. And sometimes the specialist will say things that shock you, or that you knew in the back of your mind, but you didn't want to hear it out loud. So I think being prepared for the fact that nothing is written in stone. And when a specialist gives a diagnosis, that doesn't always set the prognosis. And they might not fully explain that. Many times, depending upon the specialty, they may not be all that great at emotional support for their diagnosis. So I would just say, mental preparation, and always, these are human beings, and the things they say are not always exactly what is going to be.
And I also think it's important to go back to kind of what we learned in school. No question's a dumb question. A lot of parents say, I don't want to ask, they're educated, they're going to think I'm stupid. Well, if it's your child and you're advocating, which is what we're all doing for our children, advocating, you don't need a degree for that. You have to have the love for your child and the ability to want to make a difference. And advocating for your child is asking those questions that the ladies are speaking about, or anything else that's on your mind that concerns you, because it may help get to the root of the problem a lot quicker.
And I think to add to what everyone was speaking about, when you're coming to a specialist, it is a lot, right? You've already kind of had to advocate a lot up front to make it to that point, whether it's you're still seeking a diagnosis or you're just trying to seek help with a certain problem. And so it can be overwhelming. And then a lot of times specialists like us, my clinic in particular, we have kind of intake packets that we send out and ask families to complete. And so that may occur with a lot of different subspecialty clinics. And I think looking at those is not trying to give you extra work, which I know it is for our families, but really we're doing that so we can gather, just like one of the parents mentioned, we're trying to gather enough information up front. So one, we can schedule that patient appropriately, because it may be a visit with just a physician, or it may be a team visit in a multidisciplinary clinic. And that makes a difference with that information we have. Also, a key point is having prior test results or things available makes the appointment much more beneficial. When you come, some families assume we have access to all of that, or we've gotten that just because their PCP has referred them to us. And that doesn't occur. A lot of times we just get a one sheet kind of paper from the PCP that says behavior concern, or tone concern, and that's all we have. We don't even have their exam. So the more you can get us up front, the more beneficial that visit is going to be. As hospital systems get bigger and children's hospitals start to connect, one of the great things is something called Care Everywhere, that our electronic medical records connect. Now that's to a different level with each hospital, depending on how much they release and allow to be shared. But for instance, when I'm seeing a patient who is seen at CHOP, I can see most of their testing and the notes from the subspecialists they've seen there, which is a great way to kind of move between these systems. But there are still some hospitals being aware that don't share that. And for instance, Pittsburgh Children's, we're not able to see a lot of their information other than to know that they were seen there, but we can't see the information. And so kind of trying to work with us as providers as much as possible. We're trying to gather as much information to make that visit and our evaluation as good as it can be for you and the child.
To add to what Dr. Lindsey just said, it just reminded me, and I agree, the frustration with Pittsburgh is really very real. But many times reports get through Care Everywhere, but images may not. So you're going to go to the radiology department if your child has important images and ask for a disc to bring to your appointment or to send ahead of time, because many times it's the specialist wants to look at the actual images rather than just a report.
And I was just going to add a little bit to what Dee said, because I think I do know Dee personally a little bit, and Dee is a very strong person. Not every parent is as outspoken. And I know what Dee said may be scary. How am I an advocate for my child? What do you mean I need to be an advocate? And that's where groups and agencies like Disability Rights of West Virginia, the Centers for Independent Living, and a lot of other more disability specific agencies have access and will provide you information and training classes on how to be a self-advocate. So if you know, being a self-advocate for your child is a frightening thought for you, that reach out to one of those agencies, our agency specifically for any disability, and we'll be happy to assist you with that and provide you some training and some informational materials on exactly how to go about being a self-advocate.
Great, thank you. We will put a link to that in the comments below the video, as well as on our YouTube channel after we're finished here. So let me jump to a next question. Would any of you like to discuss your experiences as a parent or provider in accessing specialty care in West Virginia?
I'm happy to talk about that as well, because I think the doctors on here will probably find this very interesting as well. You know, how do we end up at a hospital that is 8 hours away from us? We actually had all local providers, or certainly within the Charleston area, or Charleston, Huntington area, when all of this, after our son was born and after all this started. At some point, the coordination of care became a big issue. And I would say our radiologist and our neurologist got in several disputes. We had to go to someone else to resolve those. And with the coordination of care, we got to a point where we were running all over the state. And it just practically became easier for us to schedule appointments either on the same day or over consecutive days, and to make a trip somewhere else to get all those appointments done in that time frame, as opposed to us running all over the state. With cerebral palsy, a lot of children eventually end up needing one or more surgeries throughout, especially as they're growing. And a lot of times your specialists have to sign off on whether the condition that you're seeing, that your child is seeing them for, enables them to go through this surgery. And when they were all in one place, it just became easier for us to do those things. And they also ended up coordinating, like when our son had double, I'll shorten it. Basically, it's double hip osteotomies. But the physiatrist was able to come in while they were performing that surgery to give him Botox injections to help with the pain management after this surgery. This is a terribly painful surgery, terribly painful. And so we weren't in a situation where somebody, we had to go get Botox somewhere else and then go somewhere else for the surgery. It was all there in one place, and that makes a huge difference. So, if I had to say, in terms of improvements, what we need, coordination of care is a big one. And when I started seeing the information coming out from WU about the neurology department, I am very hopeful for the future that we may have more of that here. But at the time we needed it, it wasn't really here.
No, you're exactly correct. I think that's the biggest piece And unfortunately, knowing from past history, for instance, I go back as far as going to medical school in the state. And back then, there were about one of each subspecialist for pediatrics. In a lot of subspecialties, they had no one for them. And so care was very spotty, and the few providers that were here were very limited in what they can do. I mean, you can only see, right, so many patients. And so waits would be, a year to see a subspecialist. And so initially coming back to the state, my personal experience, when I first came back, I was only one of 2.5 pediatric neurologists here at WVU, still covering a massive population. And I was also the lone person doing child development at the time. So you can imagine how difficult that becomes. Now, fast forward to about 11 years later, and we're up to 9 of us pediatric neurologists. We have additional developmental pediatricians. And so that just is one example of a subspecialty growth here in the state that's been needed for years, but that's occurring across the board now in all of the subspecialties. And the great thing about it is what then becomes of that is those subspecialties start working together exactly like you discussed. And so you start having all of these multidisciplinary clinics or interdisciplinary clinics, which essentially means you have, for instance, when you talk about a cerebral palsy or spasticity clinic, you have individuals that are from physical medicine rehab, you have orthopedic surgery, you have neurosurgery, you have the pediatric neurologist, you have your physical therapist, your occupational therapist, your speech therapist, and then you have your pediatric complex care, who are all there seeing that patient and family in the same day, in the same visit, coordinated and discussing that patient. And so we're doing that across the board with various other clinics across cardiac issues, pulmonology issues. But the examples in our subspecialty are the spasticity clinic, the muscular dystrophy clinic, the craniofacial clinic that we all have involvement in. And so that's where it has needed to go for years and is getting there, but had been very slow to start in our state just due to the lack of providers in the specialties and being a harder recruit, being a smaller state. There are definitely still holes though. Unfortunately, that usually requires coming to Morgantown for most of that care, which we know not everybody in the state lives in Morgantown or directly surrounding the area. And so there's still difficulties with travel. And that's why the Children's Hospital has really started to grow in some of its outreach clinics, as well as the use of telemedicine has really expanded, particularly with insurances, allowing it more so with COVID now as well.
I would like for a moment,
Sorry.
I know we're talking about specialties, but there's an area of medicine that really needs some dedication also in the hospitals in the state of West Virginia, is their emergency rooms, because we have to take our special needs children sometimes who are ill, high fevers, injuries, whatever, and we lack a lot of compassion and understanding to our community of special needs children, of being labeled as psychotic or out of control or misbehaving. They need a little more understanding, training, so that when our children do have to have accessibility to emergency room, that we have people that are compassionate enough to understand their need without being judgmental to the parent, and also allow the parent again to share and advocate what worked before and what could work again for their child.
And what you're saying brings up an initiative that we're working on, which is to develop a digital health passport where families can have right on their phone, which they may not carry their folder in an emergency situation. They may not take the big binder, but they always have the phone. And myself and the pulmonary department, we're trying to work together to develop something that parents can have that's a snapshot of the important action plans for their child that anybody in any emergency room would be able to see and not be in the dark about how to care for that child. But I also want to add something to what Dr. Lindsey said, because as you guys know, I participate in most of those multidisciplinary clinics, and it's a work in progress. But it's a very, very important. Care coordination is so important for the families. But when I came here, I don't think that, for instance, the administration really understood what that was. We didn't have it. And this is what I want to emphasize to all of you parents out there. It wasn't until a parent voice, my nurse practitioner is the parent of special needs child, and it wasn't until she talked to the chief of pediatrics about her experience and how she was unhappy at WV in the PICU review, she took child to Cincinnati and situation. So it wasn't added to what was already known. And so please, parents, be vocal about your needs, because we are ready to change things. But many times the administration doesn't pay attention to us doctors, but they will pay attention to the parent.
I just thought of something else, because I do think, well, we do have the questions, and so I know part of it was, like, if you don't get a referral, how would you find someone? I would, I guess, like to, say add a few things. One, check and make sure your insurance company really requires a referral because our insurance doesn't always require a referral, especially for things like PT and OT. We really have some ability to just show up, to find someone and say, I'm having this problem. The other thing is, I would also recommend talking to your friends, and people who have had good experiences with primary care providers like pediatricians. And sometimes you have to decide, if I'm not getting what I need from my pediatrician, if I'm not getting the referral I need, if I'm not getting, the coordination of care that I need them to help me with, sometimes you just have to find a new pediatrician. And that's just the way it is. And then I would add that many insurance companies offer case management. And so, but it's often a service you have to ask for. So for example, when my son had the hip osteotomies, we had to come back, like we knew coming back, we were going to need things like a hospital bed. We were going to have to arrange for transportation. We were going to have to arrange for a number of things. And so the case manager can help. They're often usually nurses. They can help advocate for some of the things you need. And in our case, our son had actually used all of our our therapies for the year before the surgery. And our case manager actually got us several months worth of additional therapy by going in and advocating and saying, this is just a 9-year-old boy, he needs therapy, and that worked. So if you can get an insurance person on board with you, they can help you find doctors and providers to help.
That's a really important point. Thanks, Allison. Let's check with Maddie and see if we have any questions online. Maddie, is there any?
Nope, you guys are good so far.
Great, thanks, Maddie. So let's touch on this before we move a little bit to a different subject. So, we've been doing part of the surveying process as part of this project, and you've been talking about the importance of care coordination. And it seems as if in some places in the state, families get kind of, shepherded in the right direction once they get a diagnosis or concerns that, there needs to be access of specialty care. And then some folks get nothing. And so for those folks who get nothing, what would you suggest for them in next steps?
I would suggest checking websites concerning that condition. For example, with cerebral palsy, there is the Cerebral Palsy Foundation, there's United Cerebral Palsy, there is the Cerebral Palsy Research Network. There are dozens. So I would suggest that. some of those organizations, and then sometimes hospitals offer parent support groups for certain conditions. And then on Facebook these days, you can find all kinds of support groups for various conditions. I belong to a number of them that deal with cerebral palsy, or a number that relate to developmental disabilities in general. And then here in West Virginia, we do have a Facebook page for Exceptional Families of West Virginia. And we often discuss a lot of the issues we've talked about, or people say, where do you get your teens medical briefs or swim briefs, or, just all kinds of information that other parents can, tell you exactly where you need to go in West Virginia to get that.
I think a resource that can help link families is not necessarily, it is tied into WVU medicine, but it's really through the university. And so that's the Centers for Excellence in Disabilities. Through WVU, they're also a very good resource that you can reach out to. And no matter what you're trying to look for, whether it be maybe a list of possible specialists to be referred to, or kind of an organization that would offer some sort of family support or some sort of training with equipment, any of that, they can usually tie you in or at least point you in the right direction. The other thing that they do offer is a clinic through their LEND grant, which is Leadership in Education and Neurodevelopmental Disabilities. They have a clinic called the Next Steps Clinic. You actually do not need a physician referral or a provider referral for it. Again, you can call in as a caregiver or family and request to be scheduled in that clinic. It's a clinic that's made up of a team of various providers, from social workers to therapists to special education resources to behavioral therapists. And then there are some medical providers there as well. Their main goal in that clinic is not to give a diagnosis or necessarily prescribe treatment. Their goal is to help you coordinate care and services and resources in your area is what that clinic's meant for. And I think it's actually a clinic that goes underutilized, unfortunately, and hasn't gotten its word out there enough.
And also that particular organization you're talking about for excellence, West Virginia. I actually had a friend that has a disability. Her son had a disability, and they needed their house, mainly their kitchen, handicap accessible. They had grants and things that were able to help make the accommodations in their home. And again, a lot of people don't know that. So they go years just making do rather than knowing that there's something out there to help you. In our area, in the Tri-County, there's a family support service. That family support services may help a family who has a assistive technology need or briefs that they need for their children and don't know how to assess it. They can either help connect you, or they will help fund that for you until you can get it connected through your insurance. A lot of, there is no book out there. I keep joking. There needs to be a book written, Hi, the Dummies Book to Navigating Special Needs Care and Life for Your Child, because there's so many things people don't know. And if they had the ability to know, they would make their life situation a little more comfortable because they have that ability to know where to go.
And I was just going to add that, Disability Rights of West Virginia is the protection and advocacy agency. So a lot of people just think about us for, legal services, but actually the biggest service we provide to individuals is information referral service. We have a huge database, and like Allison was speaking about all the great organizations for cerebral palsy. Well, we have databases full of information about the organizations for every disability, similar to the ones for cerebral palsy. We have publications. We have a Parent's Guide to Special Education. We have numerous resources available. So we also, if you call and you say, I just want information about a disability, we can send you a packet this thick with everything you need to know in the right direction to point you in. We're a great resource. Our website has a lot of those resources online. So I would like to point everybody to our resource. And we work, our sister agency is the Center for Excellence in Disability. So we work together on a lot of that stuff. And so if you have any questions, never be afraid to call us. I always tell people, don't worry about what Disability Rights does or doesn't do. Just call us and ask us the question, and we're going to help you somehow.
And I'll give you a personal recommendation. If you need that help, reach out to them. They're awesome. They're quick to call you back. They follow through. I've had nothing but awesome things to sing about advocacy through Shauna's group. They're great.
I'll add that shortly after I learned that I was going to be the mother of a child with disabilities, my mom got me a gift, and it was this book, and it's called More Than a Mom. And it is all about trying to live a balanced life, how to find providers, Medicaid programs. It is available on Amazon. And some people may find this to be a very useful tool.
Thank you. And again, we'll put links to a number of these resources after we're done with the video so people can access them. I'm going to skip around a little bit because we have about 10 minutes left. How can we build a better support system for families in West Virginia? I feel like we're touching on some ideas. So how do we synchronize them, and what kind of first steps do you think we should take?
I've often shared with DHHR, because of being a foster adoptive mom, that it would be interesting if people would agree to it and sign the HIPAA law that they're comfortable doing it. But I think it would be neat for them to categorize the special needs families and maybe get a little synopsis from them, what special needs they're dealing with and what they're working with, and maybe a number. Because when you get a diagnosis and you don't know what to do and where to go, who better than to talk to than a parent who's navigated the system? And I always get, well, that's a HIPAA violation. But if people agree to that, it would be a great resource to newly diagnosed individuals, in my opinion.
I also am always advocating for an expansion in our waiver services. West Virginia has intellectual and developmental disability waiver. We have the TBI waiver. We have some other waivers, but there are a lot of children who fall right in the cracks of those waivers. They don't quite qualify for any of them, but they would significantly benefit from the case management services and the other services provided by those Medicaid waiver agencies. So as a policy advocate, that's one thing I would like to see the state work on.
It's interesting because I guess I'll add maybe to our personal experience. I do think we need to boost up the social work type programs that we have at our hospitals, that are associated with developmental disabilities, so that they can refer people to sources. I will say, when you look at the waiver programs, we have really struggled with our case managers. We've had a lot of case managers. When they come to us, very few of them have any experience working with any children or teens who use wheelchairs. So when I'm talking about, like, say, transportation issues, they have no clue what they're talking about or what I'm talking about. I had a case manager. I've had them ask me questions like, what is music therapy? One of them asked me one time, how was it expensive to get medical care out of state? And I actually sat down with her and we started writing things like, okay, hotel, food, some things like that. But I guess what I'm saying is we need an improvement in our case management services offered by waiver, because if they don't have any experience with your condition or your child's condition, then it's very difficult to get help. So I see, the hospital component of this, and then what I guess I'll call the waiver component of it. I guess I'm hoping that maybe the independent case management might help with that situation. But for us, that there's no question that has been a big issue.
So I have a question for Allison and Shauna, because recently there was legislation that provided funds for states. It's a federal program, ACE Kids. And our group wrote up a paper and sent it to legislature right before COVID. And then when COVID happened, it was put on a table and nobody looked at it. And I'm wondering if either of you have any ideas to whether we've moved forward. Some states have gotten, supposedly October was the deadline, states to get federal money for care coordination programs for these special needs kids. And we haven't been able to hear anything from the legislature, and we doctors and nurses we don't really know how to access them. So I was just wondering if you guys had any information about that.
I know that
don't.
we did get some. I know West Virginia has done their proposal for some the American Rescue Act. I hope I'm saying that right. Spending for some of the waiver services, but it didn't so much expand the waiver services as it did just invest more money to try to improve the current services, if that makes sense.
Okay.
There was some money, Alice, that was put in place for trying to retain and train staff better, but it was more directed at direct care staff than case management services.
Well,
and I don't know how to fix the case management problem. I mean, I know about it so much, it's not even funny. I mean, a lot of our calls our question to the person is, why isn't your case manager doing that? And I think it's just a lag, to do this job, even as a case manager, but our job is similar in a lot of ways, that I have to know everything there is to know about every disability. And it takes a long time to learn that. And we have such a high rate of turnover that it is a huge problem. And I think the hospital social workers sometimes run into the same issues. They are not familiar with the resources to refer people to. They aren't familiar with what is available. And I think even if they have a good heart, there is a need for more training of case managers and kind of constant training, because things are always changing too. There's always something new. We try to do some of that, but there needs to be some more state funded initiatives as well, I think.
I can speak a little bit from the hospital standpoint. I think it goes back to a little bit of what Dr. Freeling was mentioning earlier, in that honestly, and this has been at any major hospital I've been at, but certainly more difficult in certain places, is that the social work piece of even getting that support is sometimes difficult to get supported financially from the hospital itself or administration. And so a lot of times it's left to us providers that we're trying to fill that hole. I can tell you at our clinic, that's what we do. We spend about a good 30 to 45 minutes after a new patient visit and do that social work piece, talking about insurances, programs. We keep an up-to-date running resource list. And I think that's one of the things that was kind of prepped or talked about before, is that you have some of these families who, depending where you're seeing, they get kind of this booklet or information that we're talking about kind of at the visit. And then other times, depending who you're seeing, you may not. And so it's something we're constantly asking and pushing for, because we definitely understand the importance of it and know that it could be much better. So again, I think kind of families advocating that it's an important piece to their care could be beneficial to us adding that. component. And definitely we have them in positions, but it's often, like Shauna was mentioning, that they're cross-covering a bunch of different subspecialties, or it's a social worker for the entire pediatric floor or the entire pediatric ICU. And so they may be able to help assist with those immediate discharge needs, but those more long-term programmatic, how do we continue to access this stuff? I think that's definitely a hole that is not getting filled at this point.
Thank you all so much. I want to turn to Maddie one last time. Maddie, do we have any questions or comments?
No questions.
I have one thing to add, if we're almost finished. And what we haven't talked about is what about that child with a rare condition? And this kind of brings up what Allison was talking about, is that sometimes, no matter what state you live in, you may not have the specialist that knows about that particular very rare condition. There are resources. NIH has resources. There's an organization called NORD, N-O-R-D, for rare conditions. And I would say if your child is diagnosed with a rare condition and the doctor says, you know, we don't really know anything about this, you can certainly get more information, bring it to your physician, because I think most physicians are willing to help you and learn along with you. Don't be put off by that. And definitely there are resources for those particular kids. I have many times sent my patients, even the Medicaid patients, out of state to see specific specialists. Ask your doctor to write a letter. We can write some very robust letters that can have an impact and allow those families to be seen by the maybe one out of hundreds of specialists that actually has experience with the rare condition.
Thank you. And are there any other last thoughts? We didn't get to a lot of questions, but this has been a wonderful conversation. But are there any last thoughts you'd like to have for this event? And then we'll try and hold another one and cover the things that we didn't cover.
The main thing I'd like to end with is, if you're the parent of a special needs child, always never be afraid to ask questions. Always be willing to speak up. Even if you don't get the right answer, ask it again and continually advocate, because advocating for your child will get you eventually the answers you need to make the daily life of your child go along better each day. And you.
That's great, Dee. Thank you. Anyone else? I'm so thankful that you all joined us today. I'd like to thank Allison, Dee, Drs. Freeling, Lindsey, and Shauna, and of course, Maddie, for joining us in Washington State. Keep an eye on our Facebook page. We're going to share some of the links that folks talked about today and connect you with information about our surveying project. We're on survey number 2, and getting those surveys back is really important for the ongoing process of the project. So we'll post this video also on YouTube tomorrow. So if you know somebody who's not on Facebook, which we're not all on Facebook, they can check it out on YouTube. So with that, I want to thank everybody again, especially those who watched us, and have a good day and weekend. Thanks, folks.
Thanks for having